Hello, everyone. My name is Raoul Düsterhus. I am currently an SLP student and opera singer. And in this video, we are meeting Shahram Yazdani. He is a Persian tenor who is currently living in Berlin and works as an opera singer. And he went through all diagnostics and surgery due to reflux. Reflux was diagnosed in 2020. Since then, he went through the whole process of diagnostics like gastroscopy and stuff, and later on got surgery at a clinic in Berlin. And yeah, let's hear what he has to tell. Enjoy and have a good day.
My name is Shahram Yazdani, so I'm an opera singer. I've been doing that for almost 2 decades now. I started my first studying with Maestro Delshab when I was in Iran. It's been almost 20 years ago, and then step by step I graduated and then came to Europe and met many great people. I learned a lot from them, and year by year, after a couple of years, I started to switch from the light repertoire to the heavier repertoire. I dealt with this reflux, and I had to treat myself, and I came back again to the healthy voice and so many other things. Yeah, I don't know what else shall I add to, but I try to say it so compact without all the details. By the way, this is not wine, but it's Coca-Cola. I know this is also not good, but I love it.
Okay, but sometimes it's good that you give yourself something. It's an exception, let's say. Okay,
Right.
maybe we start with the first question. When did you realize that you have reflux?
So when I realized, I think it was over 10 years ago. Maybe, yeah, I think more, 14, 15 years ago, I realized that I have reflux. But when I realized that I have the reflux problem, I also realized that why, when I was a kid, I have some problems that till then I didn't know that it was reflux. That was, for example, when I was sleeping, I could see that my pillow is wet right front of my mouth. And of course, it could not be mucus, or if yes, it was so smelling so hard. And I later on, when I was talking to my doctor, they said, of course, you were suffering from reflux. That could be the acid problem that from the childhood you had it. I remember when I was a kid, of course, I had these problems too.
So in SLP language, we call this actually drooling. Yeah, it's a drool that came out. But you don't know if it was just liquid or something from your stomach that came up?
I don't know it quite to be sure it was a reflux or not, but I can tell it could be reflux. But for a long time, I didn't have this problem. And I don't have it any longer since, I think, a decade.
Mm-hmm.
Yeah.
You said it started 10, 15 years ago. What is your age now?
I'm 36.
36. So let's say around 26 or 21, between this period, it started.
I can tell when I was almost pushing 20, I had the problem. Yeah, but when I was a kid, I had, but the time that I recognized that I have seriously reflux and I was aware of that and I took tablets and with the doctors, that was around my 20s,
Okay.
early 20s.
What have been the symptoms that you experienced?
It irritated my voice. I had to try to clean my throat so much, like so much, and it was unusual. And when I woke up in the mornings, well, it was the kind of the smell of like metal smell, and the other thing was pain in my stomach area. What else? Of course, it took me a couple of hours to get my voice back from the very harsh and deep voice to be able to sing higher notes easier, because it would affect mostly on the my higher notes, and it would add some noises like this in my singing, which I knew it cannot be pushing or technique issues. After a couple of hours, it would be gone. And I knew that it would be maybe the reflux, but never mind that I was a heavy smoker too. But I'm glad that I quit for a couple of years. I'm not smoking any longer, but I have been smoking for almost 14 years.
Okay. But
Yeah,
especially for you as a singer, it has been a problem, because when you say it affected your voice, you obviously had laryngopharyngeal reflux. Yeah, the reflux that comes up to your larynx and affects your vocal cords and distorts them and irritates. So especially for opera singers, that's something that many people are not aware of. We have a very, very sensible organ that we are using. It's not just that we're using our larynx, we also use our diaphragm and the air column that we are going to create in order to reach these high notes. I'm an opera singer myself, so I can clearly understand what Shahram was going through. Yeah, and it is something that should be definitely solved for opera singers.
That's right.
That needs to be done. And unfortunately, until today, the science is not that experienced with singers, and a lot of especially opera singers, they experience a lot of mistreatment in this case. Yeah?
Absolutely, yeah, I agree.
Yeah, something you go to the ENT, he checks your vocal cords, and sometimes he says, I don't see anything, you're fine, but that doesn't mean you don't have reflux. Yeah,
That's
reflux
right.
doesn't go always to the larynx, but it can simply affect your thorax. And they're also we are separating between the liquid acid reflux and the gas reflux. There are different forms of reflux that we can have.
That's right. Mentioning this gas thing, I don't know if I have to mention it now or the question comes later, but keep in mind, if you would like me to talk about the RESTEC test, then I have been offered to do that, which unfortunately the Krankenkasse or insurance doesn't cover, and it is almost 400 euros. And yeah, the insurance doesn't cover it. And the doctor said, if you do that and if he diagnoses as the too much gas problem, we cannot do anything for that. But at least we know what is the problem.
Yeah, that's a problem. It's an international method to especially diagnose the so-called silent reflux, or in other words, laryngopharyngeal reflux. But let's go to this a bit later.
Yes, sure.
Have you been aware of reflux before you had the symptoms?
Actually not. Whenever I realize that I have the symptoms, I try to study and learn more about that. But before, I didn't have any idea.
Okay, so you were completely unaware that it exists.
Yes.
Okay. Yeah. Sooner or later, every singer gets in touch with reflux. Everyone experiences
Unfortunately.
it doesn't need to be always organic. It can be also a case because you don't eat good foods, or you smoke, or you do too much workout in the gym, and you get a lot of pressure on your diaphragm. There are a lot of symptoms that can occur because you mistreat your body in a bad way.
Or alcohol.
Alcohol, strong alcohol. Yeah,
yes.
that's definitely a problem.
That's
okay.
Right.
How did you react to the symptoms?
You mean my body or myself in order to stop it?
More in order to stop it.
Okay. Like many others, of course, not many others, but like some people, I tried to go to the doctor, and because in Iran, it is like everyone goes to the general doctor, like here, and then you get the receipt for the specialist, and then you go there. So I didn't have any examination of my stomach when I was in Iran. They didn't write me, or whatever we call it, Magenspiegelung. I know that you will explain it later.
Gastroscopy.
Yes, I did that here, but not there. And then the doctor was just pushing my stomach and said, "Do you have pain here?" And I said, "No." "What about here?" I said, "Oh, yes." And then he gave me pantoprazole, famotidine, the different periods, not one doctor, but in different periods, I had to get to know what is pantoprazole, that he gave me 40 and one per day, he told me. I got ranitidine. I got famotidine 40 for one before sleeping, but this pantoprazole one before breakfast, and ranitidine, famotidine, pantoprazole. That was the tablets that I would get. And if it was not chemistic, they would offer me Gaviscon, or there was a liquid which was white, like milk, to stop the reflux. You would drink one sip of that, and then that was how I could maybe kind of control it. And they offered me that I raised my bed like this, or 30 degrees or 40 degrees when I want to sleep. The other offer was after 7 o'clock, I shouldn't eat anything, like afternoon eating, nothing. Late dinner was forbidden for me. And they told me don't drink between eating food, too much water or cold water. That was whatever I got as an advice from the doctors.
These are quite the common recommendations that you get when you go to the doctor. Indeed, they are correct in a lot of ways. Of course, there is a combination of the change of your lifestyle, how you live, how you eat, how you sleep. Yeah. And also there's a pharmacological treatment. It starts with diagnostics, that they check your voice. Are there any symptoms that your voice is affected, your voice box, as we call it? Or are there symptoms that refer to reflux that they can diagnose? The first way is to start a gastroscopy, actually, or even before, they can try to diagnose it with the effect of PPIs, such as pantoprazole. With how much did you start pantoprazole?
They told me the 2 weeks every day one.
But 20 milligram, 40, 80?
In Iran, they give it like 1 kilo tablets. They gave me 40 milligram, one per day, 40 in the morning.
That's quite common. Yeah, they get it actually over a period of time, usually like 3-4 months, and they check if they have any effect, a positive effect on you, yeah, with the reflux problem. And if yes, there is already quite an indication that you have really reflux, and then they go further with the diagnostics. If not, there should be other ways also to diagnose the problem. And it's maybe not always the reflux, or you don't have the common GERD reflux or the RPR, the gas reflux. Often these PPIs, they don't work then. Yeah. All right. How did it affect your profession as a singer? You already said that it affected your voice, but have you been able to sing?
I was able to sing, but not as free as I would not be diagnosed with reflux, because it gave me a very dry vocal cords. It was a bit aggressive sound. It was not, it took the how do you say, the softness of my singing, and it was a bit hoarse voice, and it would add noises. For example, if I would hit the high B flat, I could sing the B flat, but it gave like the small noises in my note as much as I would go higher. And I could realize that it also affected a bit on my range, because before, when my stomach was calm, or whenever I would take the tablets for a temporary period, for example, if I would hit the B flat or B, easier when I would get reflux and I would recognize that something is disturbing. The B-flat wouldn't be that easy to hit and to hold, and actually it would make my voice a bit thicker and a bit darker unnecessarily.
Because the vocal folds, they are affected by reflux, and it causes mucus and acid that comes up. I can completely understand, as I was affected on reflux also 5 years, and I'm glad I could solve it without surgery. The surgery is something that we get to soon, but before, which diagnostical procedures did you went through?
Can you explain it more? Maybe I'm not quite understanding the question.
They already gave you the PPIs, but maybe you did the gastroscopy. We have the manometry, pH-metry. You already talked about the Restec. How many and which ones did you?
I did the pH-metry, what is called in Japan pH-metry, and they put something into my nose, and then they put it in through my nose, and they gave me some. It was a device that they told me whenever you eat something or you drink something, press the key button. And then it was on me for 24 hours or 40 hours, and I had to even take shower with that. And
actually, I had to 24 hours.
Yes, I guess it was 24 hours. And I had to go to the shower with this. I couldn't remove it. And for that matter, Tabia would help me for that, and it was not so difficult because I knew that I'm getting treated, and I knew that I have to do that because it's not something that disturbs you. But of course, you have to sleep with that device, and you have to take shower with that device. You go out with that device. This was one thing that I did, and the other thing was this. I think gastroscopy. I think you call it OGD in Germany, ÖGD, I guess. Umlaut, OGD or the ÖGD, I don't know.
Okay, I know what you mean. Yeah, I don't know the short form for it now, but there's a short form. Yeah.
Yes. And they gave me that. Yeah, I did it, I think 2 or 3 times. And they just made me sleep with anesthesia. And they did it, and I didn't feel anything at first. And when I got the results, it was the picture and the CD, and they explained me because I was also thought that maybe I have the Helicobacter. I don't know what it is called. That was also one reason that I got this receipt from the doctor to do this gastroscopy.
Eradication. Maybe, if you had it, they would have done an eradication. But they didn't diagnose the Helicobacter, right?
No. Okay. They said no. Yeah.
Okay, because it can happen if you travel to other countries that you get these bacteria into your body and they develop, or because you eat food somewhere and the food was bad. Helicobacter pylori. Yeah. Okay, so they checked it, but it has been nothing. Okay, that's good actually. So you did this too, and the Restec, right?
Yes. I didn't do the Restec. I have been suggested, and because doctor said if you go and do Restec, I don't know if I have to talk about the surgery now, or is that your next question?
Would be the next step.
Yeah, of course, because I've been through so many second opinions, including you and other people. I have spoken, what do you think? Shall I do the surgery? I always got the second opinions. After 1 month research, because of being opera singer and suffering really a lot, just because they diagnosed the, I don't know, in English, you call it the hiatal hernia.
Yes. The hiatus hernia, we call it in German. Hiatal hernia. Yeah. It's a little gap of your diaphragm to the esophagus.
That's right. And they found it, I guess it was 3 centimeters, if I'm not wrong.
3 centimeters.
Yes.
It's still small. It's still small.
Yeah.
They say from 4 there's already like middle size, and then there's an indication to do surgery. Yeah, but a lot of surgeons that tell the small hiatal hernias you shouldn't operate because of recidives. Yeah, that because you have a high chance to get one.
Okay.
Yeah, they stitch it and they close this gap between the diaphragm and the esophagus. And because of the stitches, especially for singers, it's a problem. We do put a lot of pressure on the diaphragm, and the stitches can reopen.
Okay.
That's a problem. A lot of patients experiences. They do some wrong movement, or let's say they go to the gym in the very extreme case, they lift up the weight and it reopens. And sometimes they don't know until the stomach slides up again. And that caused again the reflux.
That's right. Yeah. And then they diagnosed that and they offered me this surgery to do the technology called LINX magnet that also you've been talking about that before I get that. And yeah, they said that this is diagnosed, and whatever the doctor told me, he said that we pulled down your stomach back, and then, as you said, they just wrapped it around and they did with the stitches. And
but that's a fundoplication.
Oh, okay. I think they did two operations.
They did two in one. As far as they told me before, they did the Fundoplicatio. They wrap around your stomach to the esophagus, and they put the LINX over it.
Okay.
In order to really squeeze it enough that the acid doesn't come up anymore.
That's right.
Like a double protection, let's say. It's not common. Right. Actually, you're the first person that I've heard has done this procedure.
Okay.
But that also means if you receive the LINX, you have this implant passport. Let's call it.
I do have it. It's a blue one. I always keep it with me because I have done an X-ray because I had to check up, because I always check up my body for many reasons, because I want to always check up how it's going, even without reason. I went through a neurologist, and then he sent me for X-ray, and I knew that I have to show this card because the X-ray people have to adjust the settings for this room that they put you in. If it's over some heat or some magnetic things, it can be dangerous, because I had to show them that I have a metal magnet here, and they said we are not allowed to go over, for example, number 5, because it's written over 5 is not allowed to, because this cannot handle that.
Yes,
I have this card with me always. When I want to do the X-ray, I'll bring it. So they did the surgery, and he also said it is the smallest size, one before the smallest size. One after that would be the smallest. They used one before the smallest size. And after 1 year, by the way, I did it in 2020. It's been 3 years now. In 2021, after a year, because I still had problems, after 1 year of the surgery, I went to my doctor. He just checked it out. He gave me the very, how do you say it? Flüssig, you say it Deutsch, but when something soft, it easily goes down.
Something liquid.
Some liquid that very easy, like an oily liquid.
You mean I know the procedure. Just forgot the name.
It's a special medical.
The X-ray. Yeah.
Yes. This is exactly for the X-ray.
I forgot the word now for it. Unbelievable.
It's not a problem, because there is a big.
Röntgenbreischluck, we call it in German.
Okay.
But what? I don't know. Röntgenbreischluck. I think it's the X-ray swallowing test in English.
Okay.
I'm not sure. They give you something liquid that you swallow, and they can see on the screen how it goes down into your esophagus.
That's right. Yeah.
I don't know the exact English term for it, but in German we call it Röntgenbreischluck.
Okay, that's interesting.
It's quite a common system to understand how your esophagus works and how food is going down.
Okay. Yeah. They did it, and doctor said, so regarding what I see in the CD, like you said, they could see how the liquid goes, and then imagine this is my head and this is my body. They had me like that, and then they put me like that my head would be here. They wanted to see if this liquid can pass my throat and go into my mouth, or something come out. And then again, they brought me back, and then they could see how fast and how easy it could pass through. Like you said, they could see everything in a monitor. After the doctor saw this, he told me that I am realizing that it's too tight. We have to widen it a bit. But he didn't do that for 1 year, because I disagreed with that. And I said, if you widen it, maybe the acid comes up again and I get the same problem. Imagine if it's not existing any longer, because if it's too soft, then to have it or not to have it is the same. Therefore, I didn't do that because of my philosophy of thinking about that, until I would also feel so much acid when I was waking up. And I called him million times on the phone, making the Sprechstunde, talking hours on the phone with him. He said, it is so tight. And I said, if it's so tight, that means the food cannot come up. Then how do I feel reflux? And he said, I have one guess and one theory. Maybe when you eat, and if you don't drink enough, the food stays before the esophagus without passing, and here produces gas and acid. And this one is giving you the feeling that you have reflux from here, but actually is on top of this ring, and it is giving you the acid thoughts. So maybe you have something to say here, then I will continue.
Yeah, it's exactly like that. You can imagine it's just a ring. It's a titanium ring, actually, that is wrapped around the esophagus, and it's quite squeezed. Yeah, sometimes it's squeezed too much, as you already said. And it's something that you need to train in order that it stretches. Yeah. And you can imagine it's like you want to go through a door and the door is not opened enough.
Yeah.
It hurts. Yeah. And you maybe are stuck in between the frame and the door. Yeah.
Yeah.
That's the same. It's a metaphor, of course, but it's the same thing that happens when you get the LINX. It stops before the entrance of the lower esophagus, where's the LINX place, and it's stuck before, and it needs to go down. So in order to get it down, you need to chew it quite liquid. You need something liquid additionally, maybe, and be patient and not panic if it stays.
Yeah, that's what I wanted to say. The first 5 months, sometimes I had to run to the toilet to vomit everything because it couldn't pass, and I was choking, and but the good thing is that you never die because of that, because
you don't die.
Whether swallow it or you throw it out.
Yeah, our nerve system tells us when there's something that shouldn't be there, and you want to throw it up again.
Yeah. For the first 4 months, 5 months, eating was a disaster.
It doesn't necessarily be because only of the LINX. It can be also because of the Fundoplicatio.
Procedure.
It's also quite strong. I don't know which type of the Fundoplicatio received, because there are several ones. The 360 degrees Nissen Fundoplicatio, or the 270, the Toupé. Then there's the door.
This doctor told me what we have done was we pulled it down, and then from the same part of your body, we cut it and we wrapped it around itself. They didn't, that's what he said.
I think that then it's maybe the 360 degree Nissen one. The Nissen one, there's a high chance that you can't throw up anymore. In your case, it seems possible. So maybe it's also Toupé, could be, I don't know. Would be very interesting to figure that out. But would you like to tell the people that are watching this video then, where did you do the surgery and who was the surgeon?
Okay. I don't know about the legal positions in Germany. Are we allowed to mention doctor's name without their permission? It's a normal thing?
Actually, yes, we don't show pictures.
Okay.
And it's obviously a good result. So
of course, it's good for him because it shows that he treated an opera singer.
Yes.
Dr. Simpson, and it's in Mick Clinic. It's in Berlin. And actually, I wanted to go to Vienna at the beginning. If you remember, I was talking to you years ago about that. And then for some reasons, maybe because of the cost, insurance, maybe difficulties, I didn't go and didn't do it. But finally, I have done it with this doctor, and they do it in that clinic especially. And he said he has done a lot of these links. And but by the way, I think I was the first opera singer in that clinic that they have done
But
this
you
too.
especially asked for this method to do, right? Because
I
we've
went there
been in
for that.
contact
Yeah.
before, and I told you about the risk that you can have with other methods that can because opera singers, they don't work by physiology the same as, let's say, other people. Yeah, we put a lot of pressure, as I already mentioned, and this method needs to stay strong in that moment when we build up our voice or our air column in our body. There's a lot of pressure going on in order to reach the notes that we are, or the sound that we are producing as opera singers. That's right. Because other procedures, they have a lot of stitching in it, and stitches can reopen. It's like actually the pressure that we build up is like a car drives over your belly, and nothing should happen, let's say. Yeah, it's very strong, very, very strong muscles that we build up in operatic singing. Also, what we need to keep in mind is that we use the larynx, and the larynx is connected with the vagus nerve. Yeah, vagus nerve shouldn't be attacked during the surgery. It's a very, very sensible nerve, one of the 12 brain nerves that we need to pay attention on.
You pointed out something about the larynx and voice. I have to mention that I was also worried about my vocal cords, because when they wanted to make me sleep, they had to put the tube between my vocal cords. And I have been talking with anesthesialists. I don't know how do you call them in English or in German. And she said that I will take extra attention, because you're an opera singer, you're very sensitive vocal cord, but we have to put something in between that because you have to breathe.
it's a tubus, it's called. And for opera singers especially, we need a shorter tubus, actually for children, in order to not reach the level of the vocal folds, the glottis. Yeah. So it's recommendable to not use the adult ones, but for the children. It's still enough to breathe, actually, and they don't get completely, or they don't touch the folds like the adult tubers. That's something actually I've learned only from another SLP who recommended this in order to not scratch it, because once their vocal folds are scratched, there is a problem for opera singers. Yeah. Because scratch vocal folds, it's an irritation. You need to have treatment for that, and maybe it's not reversible anymore.
That's right.
Yeah, you don't get to the same point anymore after this. Yeah,
that's right.
That's the problem. But so just to have it clear, actually the doctor agreed to the LINX because you had the indication for it. They did they checked the diagnostical part, and they said, okay, LINX is possible, let's do it. And you've been there, they did the surgery, and you stayed how long in the hospital?
As far as I'm concerned, it was almost a week.
Almost a week. But it shows some kind of careness about you as a patient. That's really, really good. That's really adorable.
They brought me the food that they thought it's good, and they always told me, please be careful that you are showing it really well, because it should be so small, otherwise it stucks here. But when I woke up from the very first day after the surgery, I had a lot of pain in my chest and my belly. And when I asked them, they said because your body was expanded because of the surgery. And of course, your body is in shock of this surgery, and it's normal. I think the pain was with me for the first 5 days. And When I got out of the hospital, I could walk normally. It was everything fine, but I had to carefully lay down and sit and stand up. And for the first 5 weeks, for the first 3 up to 4 weeks, he told me, don't sing big things. You can just like the whisper something like just to train your vocal cord. Don't sing big or aria.
No full voice. Yeah.
Yeah. Yeah.
Because of the diaphragmatic movements that you're doing with it. It's still risky at this point. Because obviously, I guess they also close the gap of the diaphragm, the hiatal hernia.
Yeah,
I guess
they closed it. He told me I closed it.
The stitches, they need to heal actually, and it was too early at that point.
Yeah.
He understood the pressure, that this aspect of pressure that we put on the body.
That's right.
That's really, really adorable, actually, because a lot of surgeons are not aware of that, unfortunately. Yeah, of course, no one can who didn't experience to sing. It's very, very problematic to recommend something to an opera singer. They say, oh, sometimes they overreact. Yeah, they overreact, but they can imagine how we produce the sound that goes through the orchestra. Yeah, through a I don't know, 50 to 100 person orchestra. Yeah, and we need to build up that power.
That's right.
Be very strong and resisting. Subglottal pressure is an issue in that. Yeah.
That's right.
Okay, but it seems you had a good time at the hospital and you felt cared.
And they were so nice.
They were so nice. So you would recommend it again?
They are nice people, right?
Good, great.
Yeah.
Okay. Has it been worth the risk to do the surgery?
For me, it was, if I don't do that, maybe later on I will regret. I wish I would have done it, because, you know, when you see there is a hope, I believe I'm one type of person. I think you are the same type of person like I am. I don't agree with surgery unless it's your only option.
That's good. Well said.
Yeah. I thought now is the only option. I have to try this also, because I have done many things. I have done a lot of, I quit smoking, didn't work. I didn't drink alcohol anymore, didn't work. But I should say, I guess you know it, maybe you will talk about that, or when you have already spoke about that in other programs. I could say that whenever I have stress, that increases the acid problem, the nerve and mental. And and I try to be calm, because we opera singers always have also stress about the performance, even in any level, because it doesn't say that if you are professional, famous, even Pavarotti, Corelli, everybody in every level, still they have stress of performance, because this is something that always is exciting to do. And I think that also affected on my stomach a lot. But I should say, I thought it is the last option, that I have to try it. And when I look at it now, maybe I think I did a good job to decide to do that.
Yeah, that's the mental aspect is also something very big to discuss. A lot of patients, they develop fear and anxiety because they don't know how to handle these symptoms, and they don't know where to start. They have no medical background at all, and it's like a black hole of problems for them. That's something, a separate topic. We could do another video on that, actually. But let's conclude it very shortly, that when you are having reflux, you should be mentally strong enough to evaluate things, strong enough to experiment with the body. What kind of food can I eat? What kind of sports can I do? Yeah, you have a big hiatal hernia, you can't go to the gym, actually. It's not recommendable. It's not this that you can powerlift anymore. Yeah, there's a high risk that you will damage it even more and make it worse. Yeah, but otherwise there are sports that is actually very good for the breathing process, such as swimming or diving. Yeah, that's very good for your breathing and for your lungs. And we know the diaphragm not only for singers, but also for other patients is very important for this process. Yeah, I think
That's right.
that's quite clear, right? Very obvious.
That's right. Of course. Yeah. And as maybe because you didn't experience being a smoker, but you know how it hurts, I can highly recommend to people who are smoking, please stop it if you're an opera singer, even if you are not opera singer, because it's really affects on the amount of reflux.
And coffee too much is
Yeah.
also not that good.
Yeah.
It
Yeah.
can produce acid reflux, and
Definitely.
it should be avoided. Yeah, there's a big discussion about milk, because they say milk has a lot of fat. Actually, when I see the percentage of fat that is in a package of milk, it's not that much actually. And there are other people who say, but milk grabs the acids and reduce it actually.
Okay.
Say es bindet, it connects. I don't know the English term for that, but it connects acid and makes it like together again. Yeah.
Okay.
Not spread, it doesn't become more. There are two point of views. It would be very interesting to hear an expert about that. Yeah. I'm not so sure about the evidence in that, but of course you can experiment with this. Yeah,
That's right.
trying to drink milk and check what is happening. Does it feel better or does it not? It's something how you can work on your reflux. If I eat some steak that's with a lot of fat, can I do that or can't I? It's that's the thing. That's how you need to evaluate during your everyday life. Or if the diagnostic shows I have no reflux at all, no acid reflux, no hiatal hernia, nothing, then to think also, do I maybe have a lot of stress right now? Do I have mental problems that I'm not aware of? Is there maybe a period of time in your life, for example, someone died, very extreme case, and you need to deal with that? Does it maybe affect your body? Did you had this reflux before, or does it appear just now because of this stress situation or mental situation?
That's right.
It's not always organic, but also psychological.
That's right. Yeah, that's right.
Yeah.
For me, I can feel it whenever I get stressed or angry or something or shocked. I can immediately feel the change in my stomach. Also, it sounds noises like the air changes into my stomach. And for me, the worst would be coffee, banana with the empty stomach, if I have not eaten enough, and raw onion. And when I have the raw onion with the hamburger or something.
But who eats the raw onion?
Sometimes they put it in the hamburgers with the mushrooms.
No, I understand. It was just a joke.
Yeah, and or this what I wanted to say. Recently also spaghetti. I have problem with the spaghetti with pesto. Whenever I have that, I get reflux, and
That's
also
because of
yogurt.
carbs. It's a very high amount of carbs that we put to our body. I've had an osteopath in when has it been? Last year. That was actually the time before I considered doing this LINX surgery as well. But he said, like, we are living sometimes like pigs. We need to understand what we are giving to our body, and we are what we eat.
Yeah.
And he recommended to give yourself 2 weeks, make a low carb, high protein diet, and check how your body reacts. These 2 weeks, I really went through and only eat fish, the red meat, then vegetables and salads, and actually just drank water. So that was the whole food that I ate over 2 weeks. I felt better than ever.
What kind of fish? Lux or what kind of?
Lux, and we call it forelle, this gray fish. That was not really important. I liked all the fish, and it was the first week was quite hard for me because my body really needed to understand what is going on. I didn't give my body anymore so much carbs. I was quite dizzy and a bit below my sugar level, and I didn't have so much motivation. But after this 1 week border that I crossed, I felt amazing. And I understood it's about the food. It's about the lifestyle, how we eat. Of course, what it was also during a period of my studies where I needed to learn a lot, and I sat at home and I needed to do something quick in my microwave, and you know the problem that a lot of students have. But after that, I understood I don't need surgery if I can handle it like that. It's harder and it needs a lot of discipline, but it's worth it. You don't need an extra surgery to solve it. It's not for everyone, of course, I understand. But before you consider surgery, try this.
But if you ask me again to do another surgery, I will not do that.
No. It seems you're fine with that, no? But of course, it was a, let's say, it was a fate that we met each other and that we talked about that. Yeah. Because at this time, I thought about this kind of science, and you had this problem, and I knew about the methods due also to my SLP studies. I had a lot of insight into this stuff. And I think that also for the SLPs, it's quite important to treat it. There are a lot of doctors still who don't know about the treatment of reflux by SLPs. SLPs, speech-language pathologists. It implicates something not correct, because we also for the swallowing disorders, we are there for the breathing organism, yeah. And there are already devices such as IQ Oro that train the upper esophageal sphincter. Yeah? And we can, as SLPs, work with that due to the breathing training that we are offering, connect it with the IQ Oro and work with it. Yeah? And strengthen the sphincter at least.
Okay.
And do training for the diaphragm. There are people also who have a too stiff diaphragm. And the exercises to stretch it again in order to not let it, as we call it in German, break. Yeah, this hiatal hernia, to not let it appear. It's like some kind of prevention, or if you have it, to make it more flexible. Yeah, that it doesn't slide up. Sometimes the stomach maybe even can go down. There's no evidence about that, to be honest. But that's my theory behind that we can, due to breathing activity of the diaphragm, also get it down again.
Okay.
Yeah. It would be worth some research, but of course we are also there for the voice problems that occur due to reflux. As you said, you had a lot of mucus, you couldn't hit the high notes anymore. There was some kind of organic dysphonia. Yeah, because you had this reflux esophagitis, maybe. Yeah, it came up and it was a lot of acid and gas, and it irritated your voice that you need to live and earn money and stuff. And we are there to actually understand the problem and work against that. And that's some goal that I want to achieve, that it's more conscious for doctors and SLPs, that we actually can cooperate in that case. Here in Germany, actually, there are not so many people treating it. I know one person treating reflux as an SLP, yeah, and who is a student, but is going to do it after passing all the exams.
Okay.
Yeah, that's actually the goal that we're going for. And it's important to inform people about reflux and the different kind of forms, methods, treatments, and therapy in general.
Yeah. That's right. And I have to also add, when I was with him for the second diagnose that they did this examination with the liquid, doctor told me I can see a lot of air compression into your stomach. Your stomach is full of air.
Yeah.
Maybe it's the way you take breath as an opera singer, or when you eat, you talk, or the air goes. He said this is also the problem, and he gave me a medication to break the air.
Okay. Okay, great. Do you need to burp a lot?
Of course.
It's in SLP language, we call it aerophagy.
Okay.
Yeah? It's the swallowing of air, actually, and to bring it up again. Yeah. Some kind of regurgitation, but to bring up air, not the liquid from our stomach. Yeah, not the foods. It's also some kind that actually we can treat, yeah, without surgery.
Okay.
But that's very detailed.
There is two more questions that might be interesting for those who are watching us. Maybe also the position of sleeping, because some people like me would love to sleep on the stomach. Because if I'm sleeping like that, I cannot sleep. But if I just lay on my stomach or on my belly, I can sleep. Is that affecting? And the other thing, staying long time in the toilet in order to have the stool, and then you are sometimes half an hour sitting there and pushing, this might also causes the problem. Am I right?
Could
or
be.
not?
Could be. I don't know about the toilet, but of course you put also there a lot of pressure. Yeah, you're doing this Valsalva maneuver. You know that also from the singing. Yeah, the same.
Yeah.
What we are doing, like that. And it's the same here. We put a lot of pressure again, and due to this pressure, we can bring up stomach. If you have the hiatal hernia or push on the food is still in our stomach or darm, duodenum. Yeah. I think that's, if you are on the toilet and having these problems also with the gas and stuff, take your time, try to relax, watch a video maybe, in order to get yourself relaxed and not push on it and force it to get out. Yeah, it sounds a bit strange now that we're talking about that, but it's quite an important topic that should be discussed. You need to relax actually in order that it gets out. If it doesn't get out, then you don't need to.
Yes, that's right. So, it's very important.
Yeah, but yeah, also I understand this thing because there are a lot of problems, people who have fear that when they are somewhere that they need to run to the toilet because of these things. Yeah. And most time it's simply gas. It's not the stool itself, it's a gas that makes you feel it's pushing. Yeah. That's a problem. But I think you can't solve the pushing by pushing.
That's right.
You can solve the pushing by relaxing.
That's right.
Your time, take a bit more time in the morning or in the evening, whenever, but relax, watch the video, and even if you sit half an hour, take your time. That's something, again, mental. It's about the stress that we are giving to ourselves. Okay, I need to be at work at 8 o'clock. I don't have much time in the morning. Stand up a bit earlier, take your time so that you're more relaxed the rest of the day.
That's right.
And don't eat so much carbs because it's very, very strong food most of the time. And it needs more time to digest and get down. Try to, as I said, reduce the carbs, but increase the protein. And then you are actually quite healthy in that way. Yeah,
that's right.
That's right.
Yeah.
How do you feel today after surgery, 1 year after surgery, right? And do you still need the PPIs or how is it going?
Actually, now it's I've done the surgery in December 2020.
So it's already 3 years ago.
That December will be 3 years finished.
Yeah.
And then we enter to the 4th year, and time is really running. I cannot believe that it was 3 years ago. But to be honest, maybe I cannot quietly sure answer this question, but because after the surgery, I still smoked, because I asked the doctor, shall I quit smoking immediately? He said, don't do it immediately, but reduce it, but try to quit it. After 1 or 2 months after the surgery. Not do it, because you should not, after the surgery tomorrow, no smoke at all. Just step by step, and then please don't smoke forever.
Correct.
Yeah. And maybe if I would still keep smoking, I would feel problem. But to be honest, I think I needed to do that, at least for that hiatus hernia. But honestly, sometimes when I drink, because I'm not an alcohol drinker, but once in 2 months, I might have one beer. Whenever I have the beer, or I'm not a wine drinker, but if I have one glass of wine, the day after, finito. I'm not a fresh singer because of the acid. It is still, it doesn't mean that it's after the surgery is gone. you have to still, my experience is I have to still keep my lifestyle with good eating and drinking.
Yeah.
Yeah.
It's about how you deal with your body. You are what you eat.
Yeah.
It's a good quote, actually, of the osteopath. As I remember, you did also have a consult with the osteopath once in Berlin.
Yeah. Yeah.
How has that been to you?
I could say it's a very important therapy because everybody should do it at least once in 3 months, at least. For me, I've done it a couple of times even after that time. One time I did it in Berlin. I think you recommended me that one.
Yes.
Yeah.
I recommend it a lot, actually.
And you also introduced a friend of yours who was a football player to me, who has done the LINX.
Yes, yes.
Yeah. And I got also a lot of experiences from him also for before the surgery because he has done the same thing.
Mm-hmm.
But I can tell that osteopathy is a very important thing to opening up the body and then to get more relaxed, because also I have an experience, reflux acid problem and stress makes your body squished together and you need to just chill out the body. And this osteopathy, what they do with your neck or with your hand, with your legs, it's very important. And it opens you up, and it might not show it immediately, but 2-3 days after, you feel that, wow, this is a big change.
I can completely confirm that. I did it also once when I considered doing the surgery. And I thought it was worth it. I paid 250 euros for this one session, 1 hour. It's a lot of money, but at this moment it was worth it because, first of all, I got on the right track in my life. Second, I experienced something I've never experienced before, the stretching of my legs and my body and a lot of stuff. I had a feeling I can walk on clouds, as we say in German. Really, it was an amazing feeling. You pushed a lot of my organs back into position. It was quite painful, I can tell that. But after that, the feeling was great. It was great. And I think that was an important step to go before. And yeah, at the end, actually, due to him, I figured out that I don't need a surgery, but can solve it by eating correctly. Yeah.
That's right.
That was the case. So the 250 euros was worth the price, actually.
I know it was a lot of money, but the feeling that you had, it was most important thing.
Yeah.
Afterwards, yeah. And
it's
I
quite
can tell people before the osteopathy, if you want me to give you an example, maybe it sounds a bit stupid, but you know, when you go to buy some iron or some drinks that it is under, it's the material of the juice is just sit down to the glass, you know, you can see them. And then when you shake it, it goes all together back, you know. The body, when you don't do osteopathy, is like that. But when you do the osteopathy, it wakes you up.
It wakes you up.
Yeah, you are then total. And after the osteopathy, when I did, it sounded, it was like, I was feeling a very fresh singer. I was just having a very good, how to say, cold shower. I'm awake. And yeah, it was so important. And you will feel it when you need it to do that. And that's the moment you have to go and register for the other appointment. Yeah.
It's an experience you need to make. Yeah, exactly.
Yeah. And the good thing is that nowadays, if you do that, the Krankenkasse, the insurance will pay, I think, 30% of that back.
Not always, unfortunately. I needed to pay the full amount.
Okay.
So
yeah.
I don't know the case. It's, you know, some people, they criticize it because of the evidence behind that. But evidence aside, here are two people sitting, having had a good experience with this kind of science. Yeah, I was a bit shocked about the list of diagnoses that I received, because really, indeed, there was something I couldn't really grab, even though I had already some kind of medical and therapeutic background. But anyway, I went out of this session. I had a great feeling. I had a feeling I can improve something. And in that case, I would say the evidence is a bit on the second place. Yeah, I would say so. It's more important that I got something from that helps me solving my problem, even if that session was not the real solution for my problem. But it made me get up to the next step, to the next stage of my treatment. That's I think important, and it's worth it. I'm not crying about this money.
No, indeed, I agree. Yes.
What would you say is the biggest problem in reflux treatment? If you think about patients who are now at the beginning of their diagnostics and treatments, of course, there are a lot of people sharing experiences on the doctors that they don't treat them well enough and they feel misunderstood and stuff. But what would you say is the biggest problem on the way from the diagnostics to the treatment?
In many cases, I can answer this question in 2 or 3 different ways. One way is the deal of different doctors together, because when you are an opera singer, even if you are a speaker or interviewer or whatever, you go to the surgeon, they offer you the operation. You might need it, you might not need it, but in any case, you whether do that or not. And then, for my case, I did the operation. Still, after a year, I was going to the doctor and I was quit smoking, everything. The HNO, the specialist, put the camera.
ENT
Yes,
doctor.
yes. Put the camera in and then said, you have irritation still, but it is the red, the back of your vocal cord, because the technique is perfect. You're not pushing vocally, but is irritated and you have too much mucus. And turned out that I am drinking a lot of Coca-Cola. And he said, you really need to reduce Coca-Cola because it is irritating your vocal cords, because it doesn't. And he said, please don't eat food after 7 in the afternoon.
Exactly.
Because you have to have your dinner 6:37, not 8, not 9, because the stomach and the second digestion procedure, they understand the time. Body understands what time of day it is. They stop digesting. They do this process hardly, strongly in the morning. But when you eat too much in the night, that means that the workers of this shop, they are closed. They don't work any longer. Then the food stays there, produces acid. Yeah. And that was the difficulty, because sometimes you really need to eat late, but it's difficult because you have to have a lifestyle. And it's like pregnancy for women. They are not allowed to drink alcohol, coffee. This is kind of
discipline.
It's like a professional football player. You are not allowed to do whatever the normal people do because you're a professional football player.
But it's about discipline, to show discipline, to not do these things that you usually do. But in that case, you know, it's not, you shouldn't. You know, some days ago, I've read in a group of reflux patients, someone posted, when am I allowed to drink alcohol after surgery? And I wrote under it, actually, you shouldn't drink alcohol. It's not recommendable. But you do the surgery to live again normal. I understand. Yeah, we have a system internationally that that includes also the bringing back to the everyday life, to the normal everyday life. Yeah, it's called ICE. But the thing is, you know, let's take the very dramatic case. If you had the lung cancer and they gave you treatment, you shouldn't continue smoking.
That's right.
Yeah, because you make it worse. Even though you had a surgery and they cut off the cancer, the tumor. Yeah, you shouldn't do that. And in that case, you can still do it, but it's not recommendable. The same with the reflux. You have the reflux problem. You had the surgery. but they recommend you not to drink alcohol, not to smoke. And it's something really, sorry to say, there's a lot of worth things to miss. Yeah, a lot of other things to miss that is worse. Yeah.
That's right.
You know what I mean? This is you can miss alcohol in your life.
That's
not
right.
something that you need to live.
Yeah.
Okay, I understand also people who like cake and they are not allowed to eat the cake anymore. Yeah, but it's something that you can miss. There's other stuff you can eat instead, especially when you do it fresh. Yeah.
Yeah, I know. But as a former smoker, I can tell nothing can be enjoyable than smoking cigarette front of the ocean or having a smoke after. But I had a bigger desire, which was my career, my singing, and my stuff. And I thought of that desire and passion, and I said, okay, which one is worth it? To enjoy cigarette, which is destroying your body, or enjoy your career for other 50 years of your life?
Exactly.
And that was a big reason to quit.
Exactly. So you need to have your priorities right.
Yeah. And I'm so happy about that. I'm not missing cigarette at all. Not at all. Not at all. But also I have to say and add something that unfortunately, regarding my experiences talking with people, most of people, not everyone, but a big number of people, I wish they believed in science, because science is there. They have done a lot of tests. If they recommend something to the people, they have researched, they have done a lot of research. They might have bugs, they might have mistakes, but the mistakes are in the minority.
Yeah,
I can say the science we need to a bit trust more.
Of course, in the methods, surgery methods, it's a bit different, because there are methods like the Fundoplicatio that is the oldest method actually and has the most evidence, because there have been so many patients already and enough studies that you can refer to. But for example, there is another procedure called Reflux-Stop. It's quite new, and we don't have so much evidence yet, yeah, compared to the Fundoplicatio. So there's a difference in the methods. LINX also is still quite new compared to the Fundoplicatio, but already we have more evidence than compared to the Reflux-Stop device. Yeah.
So what would you recommend to a person who wants to do surgery?
You can't recommend a method without the complete diagnostics. Yeah, you need diagnostics in order to understand the problem, in order to understand the person, and in order to understand which indication you have for what kind of methods. Yeah, if you work in an office and you have a small hiatal hernia and a maybe weak sphincter, you can actually almost take every method, I would say, if there's nothing else that causes your reflux. Yeah, but if you're, for example, someone like you, opera singer, who puts a lot of pressure on it, actually there should be as less stitches as possible. Yeah, and it should be something really, really trustful. Yeah, that you can trust that it stays, because I don't think that you can break open your LINX. There should be such a force on it that this happens, and actually I've never heard about that it can happen. So actually the LINX is the device for singers or people who use the body like that as much as we do with the pressure. Yeah, you can't recommend like that. First of all, I'm not a surgeon. Yeah, and I'm of course staying away from recommending methods actually. But in your case, it was important for me to bring you to an idea, yeah, to get a bit overview over that. Yeah, that's why I said think about the LINX, but actually the surgeons should decide, is it the correct procedure for you? And it seems it has been correct. Yeah, as you're sitting here now and you can sing again, and that's really good to hear also positive experiences, because you read a lot of wrong surgeries. And
I should add something on beside whatever we are talking about medical things. As an opera singer who has been studying for many years, of course, we never stop studying. We in any level we are studying, but it's been almost 7 years that my body, myself, I recognize that we should not push. Because when we sing, when we are talking about pushing, the opera singers push more than the people, we are talking about the normal and allowed push, not force. We are talking about that we opera singers use the body more than the normal people. And this is very true. And but before, when I was younger, maybe when I was in my 20s, I would hardly push my diaphragm physically. And I am guessing that that problem can come from those times that I was not experienced singer enough. I was very young, and I would push hard physical. After 7 years, I realized that you shouldn't push. The big voice comes out of the big respiratory system. That can be also the cause of that hernia that I had it for many years ago.
That's why it's important to have a teacher at the beginning to lead you to the correct point of breathing. Yeah. But sometimes also we need to mention there's a misunderstanding of operatic breathing. Yeah, a lot of times how we use our muscles in order to breathe. A lot of singers breathe too high. Some are breathing just abdominal. Yeah, there's a perfect combination. We call it costo-abdominal breathing, actually. That rib cage moves freely, due to the abdominal movement. Yeah, it's connected. So, but
That's right.
There's a lot of misunderstanding in that, and I think it can also cause the hiatal hernias if we put too much on it. We have a lot of singers having this problem. I think you know a lot, and I know. Just now in my mind, I have 5 singers who have surgery, who have done surgery. Not everyone with the LINX. 4 have LINX, 1 have the Fundoplicatio, the Nissen one.
Okay.
Yeah.
How do they deal with that? Do they complain, or are they happy?
The one with the Nissen or the other ones with the LINX?
All. How do they?
So one of them is you. Yeah. The other 3. One of them, even that's the one where I gave you the contacts.
Yeah.
So he's fine. And the other 2, they are completely fine. They're singing again, they're teaching, not complaining at all. The other one with the Fundoplicatios, he is singing at the theater right now. He's quite young compared to us now. He's, I think, beginning of his 20s, but I'm not sure.
Okay.
And he's fine with that. No, but it was, of course, a change in his life as far as I know.
Yeah. But if you ask me if I'm happy with that or not, I say I'm happy. And I'm thinking that I should have done it, and I'm happy. The only difference, if I wouldn't do that, is I would always have this problem, reflux. But when I did it, I didn't have problem unless I eat and drink wrong.
Yeah. So it's up to you to decide if you need that or not.
You can have an operation to solve the problem, but it doesn't mean that you're guaranteed eat and drink whatever you want. No. No. This is the biggest quote I can say after the surgery, even after LINX.
That's actually a good point, because it was my last question to what would you recommend, and actually you answered it. To not think that you can behave like usual, that you can eat and drink as much as you want again, and as you want, go to the restaurant every night or eat pizza every evening. No. It's not like that. You still need to.
It doesn't do magic.
You can't. No one can do magic, and we can't expect from the surgeons. I think they're doing a good job, and this field of reflux and visceral diseases is quite difficult to understand. There's a lot of factors that are included, as we said, mental aspects, organic aspects, pharmacological aspects. The use of pantoprazole, famotidine, ranitidine, stuff like that. There are a lot of people using antidepressants to solve the problem, but that's another topic. Okay, but anyway, I'm really glad that it helped you and that you found the right way to again sing freely with that.
Yes, of course, and thank you to you that we had a lot of discussions through the phone, in person, everything. That was so important. And if you can call it advice, or you can call it my opinion to the people who have this reflux, they really need to research a lot before doing anything, and with the experts. And I'm so glad that you are doing this video, because I well remember how I was in also internet to find source, because you know, you will be happy when you find some source in YouTube. Oh, let me watch it, you know.
Yeah.
This video would be a good how do you say, help tool for people who are researching about the results, because this is a very nice job of you that you are doing that, because many people need this video.
Yeah,
Really
they need a first impression what can be done before.
Yeah.
And
Yeah, it warms their hearts too. Yeah.
Yeah, and of course it maybe calms them down a bit if they hear there's someone who had this experience already and he's fine. Because
Yeah,
you always hear these little horror stories, everything went wrong. It's not always like that. Because in my opinion, then something was missing in this whole procedure. Otherwise, the treatment would have been correct. Yeah, and the results would be good. But if there is stuff that is still recurring after surgery, like still acid coming up and still the same problems or even stronger problems, something went wrong, definitely. Yeah, something was skipped in the procedure of diagnostics. Something was missed. Yeah,
that's right. I always am the fan of the things that if I have this notebook, if it's damaged, first I have to see if I can fix it.
Yeah.
If there is no way to fix it, I will buy a new one.
Exactly. Good. That's a great metaphor. Yeah. I think that's a great final quote that you did now. And yeah, I'm very thankful that you took the time to.
Yeah, likewise. Thanks for having me.
At some point we can do a second part, because there's so much stuff to discuss. We skipped a few things, but there was a lot of stuff to answer already.
That's amazing, and thank you so much. And it was a great reason to see us after a long time again.
Thank you. Likewise.
Yeah, thank you. Say hi to the belongings, and hopefully we see us soon. And thanks for having me again. And that was so interesting.
Same here. Thank you for your time.
Thank you so much.
Bye bye.
Ciao. Ciao.